So how to get started? You start with 11th, 12th, you start with choosing the right subjects. Now your subjects are going to be physics, chemistry, biology. Besides that, you'll be studying English, and there's going to be a fifth optional subject, which could be maths or IP or engineering, drawing, physical education, whatever it is. My advice here is that you choose your fifth subject very, very carefully. Your fifth subject should be as scoring as possible and as less time consuming as possible. In my case, I dropped mathematics out of my 11th, 12th course, and I picked up psychology instead, because it was not that I was weak in maths or anything. I had 98 in my 10th boards, and I was confident that if I study it properly, I'll be able to get good marks. But that was not required. From entrance point of view, it was just not required. So concentrate on your core subjects, that is your physics, chemistry, biology. And your school plays a very important role in that. It sets the pace for your preparation. It strengthens your basics and your uh, syllabus that is to be covered slowly. Then again, you get your personal attention from all your teachers, and everything, you know your teachers very well. You can always ask them for your questions or any doubts. And most importantly, your school prepares you for your board exams. Now board exams are not to be neglected by students of 11th, 12th. It is very important. It is your backup plan. If you do not succeed in your medical entrance, it is your 12th boards that are going to get you an admission into a non-medical course. Other than that, coaching is almost mandatory in today's world. It exposes you to more study material. It gives you a competitive environment. It tells you where you stand with respect to other students, because in the end, your medical entrance is a competitive exam. So you have to know where you rank with respect to other students from so many other schools in your state. Private tuitions also help you in that sense, that they give you personal attention and you can actually concentrate on your weaker subjects. So you don't necessarily have to re-revise all your strong subjects. You can concentrate on your weaker subjects also. So now that you have finished your 12th in your school, now you'll be appearing for your board exams. And once you finish with your board exams, you know the importance of board exams. After that, you'll be giving your medical entrance exams, that is mainly your NEET exam. Now these days there is AIMS and other autonomous institutes like JIPMER are also taking admission through NEET only. So NEET forms your main exam that you will be giving. Now NEET is National Eligibility Cum Entrance Test, and it is an objective MCQ based exam. So you know your approach towards an objective MCQ exam is going to be completely different from how you prepare for your board exams, which are subjective exams. And your subjects are also going to expand. From physics, chemistry, you'll be studying biology as botany and zoology, and that will form 50% of your subjects. And this is a highly competitive exam, almost 15 lakh applicants every year, and roughly around 84,000 medical seats for students. And if you include dental also, then around 27,000 seats. So there are more chances of being excluded out of the race rather than cracking the entrance. Out of these 84,000, 15% of your seats are going through your All India quota, and 85% are reserved from your state. So if you are studying in a Delhi school, you are eligible for all the seats in Delhi medical colleges. And these Delhi medical colleges include AIMS, Maulana Azad Medical College, Lady Harding, and there are 8 medical colleges in Delhi. So you are entitled for 85% of the seats in these colleges. So once you crack NEET, you get All India rank and you get a state rank. And based on your state rank, you can opt for a medical college in your state of Delhi. These can be divided into government medical colleges and private medical colleges. Now, government medical colleges definitely have a higher clinical exposure and they have a low fee structure. And the faculty also is highly qualified national level faculty. Private medical colleges, on the other hand, are also good. They have a better infrastructure and better facilities, but the fee structure is very high and faculty is also good. So my advice to all the students appearing for NEET in the coming years is, I as a student, In our times, we used to have a lot of medical entrance exams. We used to sit for CBSE, for DPMT, AIMS, BHU, AFMC, Manipal. We had to fill all these forms and appear for them individually. So every exam had a different pattern. In my year, I had cracked all the entrance exams that I had given at that time. I secured a rank of 600 in CBSE, a rank of 177 in Delhi PMT. I cleared Manipal, I cleared AFMC. So my strategy for studying was basically on the subjects, making your concept strong. And in that case, whatever pattern of exam you are going to face, you will not have a problem with that. So focus on your studies. Fix your study material from the beginning. You know which books you have to study, you know what study material you need, and with that you have to stick to it. Do it thoroughly. Do not expand your study material just before exams कि चलो किसी ने ये book बता दी, ये भी कर लो, ये paper बता दिया, ये भी कर लो. Just fixate your exams and your question papers. Do your question papers repeatedly. Know your weaknesses. कौन से subject में मैं कौन से topic में weak हूँ. I must stress on that, especially if those have been asked again and again in your previous year question papers. You must work on them. Make notes, have a schedule, do regular self-assessment. Your coaching will help you in that, and practice papers in real time. Real time मतलब अगर 3 hours का paper में बैठे तो 3 hours के लिए बैठ जाओ and give your exam. It is different to solve a numerical in another setting and to solve it when you are sitting in an examination hall with a stipulated time. So if you do that, you revise your subject, revise them properly, then you should be able to crack it. The most important thing that I would tell to all the students appearing for NEET is that the day of your exam is most important. You must have a very clear mind on the day of your exam, and that means that you have to be aware of the marking system. Negative marking hai, you should know which questions to attempt and which not to attempt. Also, this is something that was told to us by our teachers, that her paper mein there are different levels of questions. The first few questions, around 60% of the paper, is something that all the students will be able to clear. So all the students can answer those questions. They are that simple. If you make any silly mistakes, you are out of the race. So be very careful not to make any silly mistakes in basic questions. The next 20 to 30% of your questions, they are going to be based on your study that you have done. So if you have been studying well, you'll be able to crack those 20-30% of the questions also. So, but they will be your rank deciding questions. In way, the better you perform, the better your rank, and obviously the better medical college you will be getting. And the last is your top 10% questions that are going to be very, very difficult to crack. Those will be the questions for mainly the toppers and the creamy layer. So if they get it, they'll be rank 1 or rank 10. So you don't need to worry about them. You need to concentrate on the majority of 80-90% of the paper that you have to crack. And for that, you have to keep a very positive approach. And positive approach, I mean ki when we used to give all the exams, there used to be some entrances where you used to have only 2 seats. Like in CNC Ludhiana, there used to be 2 seats. So one of my friends was filling the form for CNC Ludhiana, and I asked him ki, why are you filling the form only for 2 seats? So he was like, so what, I just need 1 seat. So that is the kind of positive approach which you need to keep. And there is no disheartening even if you fail, because you can always attempt again. So if you get selected in these NEET exams, your next is going to be a counseling where you'll be picking up your choice of medical college in your choice of state. And with a brief medical fitness, then you're good to go and ready to enter a medical college. Now, life in a medical college is fun-filled, but also full of studies. The whole curriculum of MBBS is divided into 4.5 years, where you'll be appearing for 4 professional exams. And just before professional exams, you'll be giving your centups or pre-profs, just like you give pre-boards before your boards. All the exams are going to be theory and practical based. And also with your second year, you'll be starting your clinical postings. And at the end of these clinical postings, you give your ward leaving exams. So by the time you finish your 4.5 years of MBBS curriculum, you will be granted a provisional medical degree. And with this provisional medical degree, you'll be entitled to work as a medical practitioner under supervision. So after these 4.5 years, you enter your 1 year of internship. So this internship is a compulsory rotatory posting in all the clinical departments in your hospital. And during this time, you'll get the maximum exposure to patients, and you will get the real doctor experience that you all always were waiting for. And the side is that you have to continue your studies alongside your long duty hours, which is the difficult part in internship. Also, it's a very, very grilling, tough job. Interns form the backbone of the hospital, and they are the ones which are loaded with the maximum amount of work and responsibility. They are the lowest in the hierarchy of doctors working in the hospital. So obviously, they have the maximum work to do. But the good thing is that you start getting paid as a doctor. So this is the first time you'll be earning as a doctor, and this is a good feeling. So internship ends after 1 year. Then what after that? After that, you'll again be facing entrance exams in the form of NEET PG entrance exams, which are also again objective exams. There'll be MCQ based exams, and again, it is highly competitive. Almost 1.5 lakh students, 1.5 lakh doctors are sitting for this exam every year, and only around 30 to 40,000 PG seats are available. So this PG is going to be your specialization. So whichever is your branch of choice, whether you wanted to be a pathologist, a dermatologist, or a radiologist, this is after cracking NEET PG, you will be able to pick up this line and pursue it further. So there will be branches where there is no direct dealing with patients, where you sit in a lab and examine specimens like pathology, microbiology, or you could be a physician or a surgeon who directly deals with patients, treats them with medicines, or wherever surgery is required. In case you're not able to crack the NEET PG in the first attempt, then you can have a gap period. You'll be dropping. In that time, you decide either you want to study purely and prepare for the next year, or you could be working side by side. So if you want to continue earning, you could be joining as a junior resident in any government or private hospital, where you'll be working as a doctor, also earning for yourself and side by side preparing for your entrance exams. Other than that, there is the option of flying abroad. You can go to other countries like USA, England, for which you'll have to clear their respective licensing exams. Only then you'll be allowed to practice in those countries. So after you are done with your PG, and which is going to be for 3 years, and at the end of this PG, you'll be submitting a thesis, and you'll be giving a final exam where you'll be giving a theory and practical. And all along these 3 years, you're going to be study side by side doing your job, your work in the hospital. You're going to be treating patients, you'll be seeing OPDs, you'll be operating on them, and also studying at the same time. There is no leave, preparatory leave given for this. So it's a difficult job. Uh, a diploma course can be done in 2 years, where you will have no thesis, and rest everything, working, examination, everything is going to be the same. And after completing your PG, now you can start working as a doctor. Now, either you start your own private practice, or you go into a government job or a teaching job or a corporate job. The other option is that you can extend your clinical experience by another 3 years by doing a senior residency. Now, a senior resident is a government employee. They are class one government employees, so the pay scale is according to that. And you preferably do it in a government hospital where you can get maximum clinical exposure and you get to refine your skills. And also, if you want to go into teaching jobs, this is a mandatory clause. Also, if you still have a mood to study further, then you can do your super specialization as a DM or as an MCH, which is going to be for a period of 3 years. So after that, you can go for a fellowship, or you still want to study, you can always continue with your fellowship. So there is no end to studying. So what I mean to say at the end of this whole career guidance is that picking up medical profession is a very long learning journey. It is forever evolving and changing. You have to keep yourself updated all the time, and you have to study the latest updated books, updated journals, and it requires a lot of commitment and consistency. But it is very noble and highly rewarding. Every patient that you cure successfully is an appraisal for you. And with time, it only gets better. So that is all I have to say about my profession. I hope I was able to clear a few doubts.